Hello guys, so today we shall be discussing regarding the abdominal aorta and all the branches which are present on the abdominal aorta. Okay, so this is gonna be a very interesting and very important lecture. So we shall be mainly focusing on the abdominal aorta. So in the discussion of this abdominal aorta, what are the important things we shall discuss now? Now look here. All of you know very well that let us say this is our heart. Okay, let us say this is our heart. Now you have got a vessel that is coming out of your left ventricle. There is an artery like this that is coming out of your left ventricle, right? So what is this? This is called as your aorta, right? Now this aorta, it comes down all the way, it makes an arch, so you call it as arch of an aorta, right? So this aorta, it descends down all the way. So as it is descending down, you call this as a descending part of the aorta. So obviously this part is called as arc of aorta, okay, and this is called as descending part of the aorta or descending aorta. Okay, now this descending aorta, it descends down all the way and finally it divides into two main branches. These two main branches are called as common iliac arteries. Common iliac arteries. Okay, now we shall be discussing mainly about the descending part of the aorta. Okay, so let me draw the descending part of the aorta now. So this will be your descending part of the aorta. Okay, and finally I told you descending part of the aorta divides into two branches. Now these two branches are called as common iliacs. Okay, so now let me with an like an imaginary line, guys, let me divide this descending part of the aorta into two different ways. Okay, the descending part of the aorta is divided into each section. Okay, the descending part of the aorta is divided into sections. So let me divide it. So as you can see here, these are the sections. So this is 1, this is 2, this is 2, this is 3, okay, this is 4, and finally we have got 5. So there are basically 5 sections which I have divided, right? Now in these 5 sections, what are the important things to be noted? So this is at the level of T12, this is at the level of L1, this will be at the level of L2, L3 and L4. So at the level of T2, from the abdominal aorta, what is this artery which we are getting here, right? So let me write it. So this thing which is coming out of this is called as a celiac trunk. This is called as the celiac trunk. Okay, and after that we have got another vessel that is coming out all the way like this at the level of L1. This is called as superior mesenteric artery. Okay, this is called as superior mesenteric artery. This artery is called as superior mesenteric artery. And after that we have got two more branches, guys. Okay, what are these two more branches? At the level of L2 we have got two branches like this, and there is another branch in this way. So on both the sides we have got these two branches. Now what are these two branches on both the sides, guys? So one branch here, you call this as a renal artery. What do you call it as? You call it as a renal artery. Okay, and the next branch here, you call it as a gonadal artery. You call it as a gonadal artery. So one you call it as a renal artery and the other one you call it as a gonadal artery. Now after superior mesenteric artery we have got inferior mesenteric artery. So exactly at the level of L3 we have got this branch, and this is called as a inferior mesenteric artery. Inferior mesenteric artery. So we have got both superior as well as inferior mesenteric artery, and obviously it is very simple thing that these two branches here are called as common iliac arteries. These are called as common iliac arteries. Now common iliac arteries in turn divide into two. So one is called as external iliac, which is coming inside is called as internal iliac, right? So this will be your internal iliac and this will be your external iliac. Okay, this is your external iliac and this is your internal iliac. Okay, so these are the very important branches, guys, which you need to know regarding the abdominal aorta. So even you can learn like this. T12 is equal to, there we have celiac trunk, and in that way also you can learn, but diagrammatic representation will be much more easier for you to imagine and put the correct option in MCQs. Okay, so T12 will be the celiac trunk, L1 is the superior mesenteric artery, L2 are both the renal as well as the gonadal arteries, L3 is the inferior mesenteric artery, and from L4 we don't have any branch. Okay, so now we shall be discussing about celiac trunk first. After that we shall discuss about superior mesenteric artery as well as inferior mesenteric artery. Okay, these are the main branches. So what are the branches of celiac trunk, superior and inferior mesenteric artery? We shall discuss in a complete lecture now. So now we shall be discussing about celiac trunk and its branches. Okay, we shall have a complete focus of the celiac trunk as its branches. Now, in the celiac trunk and its branches, you have to know that this is the stomach and here we have a duodenum. Okay, now in the stomach you have got two important things. What are those two important things? One, on the left side, whatever is there, right? So this is called as the short gastric, the lesser curvature, and this entire thing all over here, this is called as the greater curvature of the stomach. So we have got two important things, lesser curvature as well as a greater curvature. And obviously here you have got your liver, right? And you even have got your spleen like this. Okay, that is the hilum of the spleen. Now, as I told you already that in the center I have got a branch like this. So this artery which is going down all the way, right? So this artery is called as the abdominal aorta. This artery is called as the abdominal aorta. Okay, now this abdominal aorta will give out many branches. Now what are these branches? Look here, in the center at the level of T12, I told you we have got an artery, and that artery I named it as what? I named it as celiac trunk. Now that celiac trunk will give some branches, guys. What are those branches? The first branch is, it gives a branch all the way like this, and this branch supplies to your lesser curvature of the stomach. So this branch is called as left gastric artery. What is this? This is called as left gastric artery. Okay, instead of naming these things, let me put the numbering so that I will label this at the end. Okay, but for now you should remember it as left gastric artery. There is a second branch. Look here, this second branch goes all the way like this. Okay, now it goes behind your stomach in this way. So how it is going behind your stomach? In a tortuous way. And finally this supplies to your spleen. So this second branch, whatever is there, initially it is right, then it goes behind the stomach in a tortuous way, and then it is supplying to your spleen. Now this is called as a splenic artery. But why is this splenic artery tortuous behind the stomach? The reason is that whenever you eat food or whenever you drink water, the stomach stretches out. When it stretches out, what will happen if the splenic artery was straight? When the stomach stretches out, the artery might rupture. So to prevent that rupture, right, we have this tortuosity of the splenic artery. Clear? So this is the splenic artery. Now splenic artery gives out two more branches. Now one branch goes above and supplies only till a short distance like this. Okay, so this is a branch that is going above and supplying only a short distance. This is called as short gastric artery. The third artery will be your short gastric artery. Okay, now there is another artery that comes down all the way like this, down all the way. Now this artery is called as left gastro-omental artery, or also called as left gastroepiploic artery. Okay, the fourth artery is called as left gastro-omental artery or left gastroepiploic artery. Clear? I will write all these things. I'll label all these things. So just first listen to what I'm telling you. Right. Next important thing is that this gives a branch here. Now this artery which is coming out, this is called as a hepatic artery proper. What is this? This is hepatic artery proper. This hepatic artery proper, so this artery which is coming out like this is called as common hepatic artery. What is this? Common hepatic artery. Now this common hepatic artery divides into two more branches. Now one branch enters into your liver. Okay. So, okay, let me write it down. This is artery number 5, that is common hepatic artery. Common hepatic artery is divided into two branches. One is artery 6. What is this? This is called as hepatic artery proper. Hepatic artery proper. Now, this common hepatic artery gives out one branch called hepatic artery proper. Then what is the other branch? Look here. The other branch comes down all the way like this. Now, where this branch is lying? This branch is lying somewhere, right? This branch is lying somewhere nearer to where? It is lying nearer to your duodenum as well as your stomach. So, you have to call it as gastroduodenal artery because it is lying in between the duodenum as well as the stomach. So, you should call it as gastroduodenal artery. Okay. So, artery 7 is called gastroduodenal artery, which is a branch of common hepatic artery. Now, this gastroduodenal artery, all of you, now keep it in your mind that you have got pancreas here. You have got pancreas like this, right? This is your pancreas. All of you know that this artery number 7, that is gastroduodenal artery, gives out two more branches. What are those two more branches? Now look here. One branch goes all the way and makes an anastomosis with this branch. What is branch number 4, guys? I told you branch number 4 is called as left gastro-omental artery or left gastro-epiploic artery. Now, there is some artery that is making anastomosis with left gastro-omental artery. So, you should call it as right gastro-omental artery. So, this artery is called right gastro-omental artery. That is artery number 8. Then, what is the other branch of artery number 7? What is the other branch of gastroduodenal artery? Now, this gastroduodenal artery gives out a branch that supplies to the pancreas. Now, look here. This artery is purely lying in between duodenum on one side, head of the pancreas on other side. So, it is crossing the duodenum and it is entering into the pancreas. So, it is called as duodenal-pancreatic artery or pancreatoduodenal artery. It should be called as pancreatoduodenal artery. Okay, because it is touching the pancreas, it is touching the duodenum. So, pancreatoduodenal artery, and it is supplying onto the top. So, you call it as superior pancreatoduodenal artery, artery number 9, superior pancreatoduodenal artery, right? So, all of you understood till here. Now, another important thing I want to tell you is that, look here, at the level of L1, in my previous lectures I discussed that at the level of L1, there was another branch. So, at the level of L1, there was a branch that is coming out like this. This was called as superior mesenteric artery. Superior mesenteric artery. Now, this superior mesenteric artery also gives a branch that goes above and anastomosis with superior pancreatoduodenal artery. Now, what is this branch? This branch is supplying the lower surface of pancreas. So, can I call it as inferior pancreatoduodenal artery? Yeah. Yes, this is called as inferior pancreatoduodenal artery. One was called as superior pancreatoduodenal. Now, this is called as inferior pancreatoduodenal artery. Right? So, these are the important things which you need to know. So, let me name all these 10 arteries here itself. The first artery, what was this first artery? This is called as left gastric artery. What is the second artery? The second artery is called as splenic artery. Splenic artery gave two branches. What is the third one and fourth one? Third one is called as short gastric artery. And fourth one is called as right gastro-omental artery, or, okay, let me write it down, guys. Right gastro-omental artery or right gastroepiploic artery, right gastroomental artery or right gastroepiploic artery. Okay, now what is the fifth branch, guys? Where is the fifth branch? Yes, the fifth branch is directly coming from the celiac trunk. What is this? This is called as common hepatic artery. Common hepatic artery. Now common hepatic artery gives two branches. One is called as hepatic artery proper, right? One is called as hepatic artery proper, okay, and the other one is called as gastroduodenal artery. Gastroduodenal artery. Now this gastroduodenal artery gives out two more branches, right? What are those two more branches? 8th and 9th branch. What is that? One is called as left gastroomental artery or left gastroepiploic artery, okay, and the other branch is superior pancreatoduodenal artery. Pancreatoduodenal artery. What is the 10th branch that would be that is coming from? What is the 10th branch? The 10th branch is coming from where? It is coming from your superior mesenteric artery. So it should be called as inferior pancreatoduodenal artery. Okay, so this is the 10th one is an inferior branch. And next important thing is that this hepatic artery proper, that is artery number 6, it divides into two more branches here. It divides into two more branches. One is called as the right hepatic artery, another one is the left hepatic artery. Okay, so these are the important things which you need to know. Now in case of celiac trunk, first clinical case, there was a question that was asked in USMLE, that is what happens to a patient blood supply to the liver, stomach as well as the spleen if there is thrombosis of if there is thrombosis of the celiac trunk. If there is a thrombosis, there is a clot, let us say there is a clot that is formed within the celiac trunk. Okay, this is a black color clot. Now if there is a clot that is formed in the celiac trunk, then celiac trunk is the one which supplies to your liver, it supplies to your spleen, it supplies to your stomach as well, it even supplies to your pancreas. So if there is a clot there, if there is a thrombus there, then how do you think all these organs will be supplied by blood? They won't be supplied, right, normally, because there is no blood supply here, there is no blood supply here, there is no blood supply to this portion. All the blood supply is cut off because of this thrombus. But still, in the question is asking, despite of this thrombus present, still there is blood supply. Now how is this happening? How is this happening is that the blood flows like this. You see, blood is flowing like this, blood is flowing like this. It cannot enter into the celiac trunk because it is what? It is completely having a thrombus. So it will take a U-turn in this way and goes down. It goes down, 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 and it will enter into superior mesenteric artery. From superior mesenteric artery, it will enter into inferior pancreatoduodenal artery like this, and from here it will enter into superior pancreatoduodenal artery. From the superior pancreatoduodenal artery, it gives blood supply in this way to your liver. In the same way, it goes opposite in this way and gives blood supply to your stomach and blood supply to your spleen. You see this? This is the most important anastomos, guys. So the combination of superior and inferior mesenteric artery is the most important anastomos which you have to definitely know at any cost. Okay, so all these which we have discussed are the branches. And another important thing, right? So these are the important things which you need to know. Important thing which you need to know in the celiac trunk. Okay, so these are the branches of the celiac trunk.